Hi, welcome to the section of cardiology, the study of the heart. This is Dr. Jaitly. Here I'm going to be talking to you very briefly on this video vignette. What is metabolic syndrome, or what it was called as syndrome X? And they are interchangeable terms again, but syndrome X and metabolic syndrome, they are one and the same thing. So when you say a syndrome normally is a collection of various conditions, various symptoms. In other words, one does not point out to one particular organ. So essentially, that's how you define a syndrome. Now, metabolic implies that obviously there's some involvement with the metabolism. Now, we know what's involvement with the metabolism is your liver, your pancreas, your ability to control your weight, and therefore the vascular or the cardiovascular system is involved. So it's been coined metabolic syndrome because it includes some of what I just mentioned in the past couple of minutes. One, it has an insulin resistance that has been shown. That means the pancreas is right here on my left panel. I'm showing you this blue structure called the pancreas sitting right behind the stomach next to the liver. So there is insulin being produced by this organ, and so this way the sugar is nicely controlled or regulated. As a result, there is an insulin resistance in this condition called metabolic syndrome, where even though insulin comes to the tissues, but it's not being recognized as insulin. So what happens? Your sugars continue to rise because you require insulin to be recognized at the cell level in order to metabolize that sugar. So now you continue eating. As a result, your sugar is constantly going up. Your calories are being pushed into the fat cells, so you start to put on weight, while insulin resistance only gets worse. So insulin resistance is an important issue. Now, once you start putting on the weight, then obviously hypertension will come in. As a result, your blood pressure will start to creep up. So you have a central obesity, you have insulin resistance, and you have high blood pressure. Now, this is how you remember all the 4 or 5 things that I'm going to enumerate, which includes this metabolic syndrome. The fourth thing that happens is your cholesterol, because a lot of such patients will also have low HDL. Now remember, HDL is very protective to the vascular system, like wherever the circulation is going around, from brain to thyroid to chest to heart. Obviously, heart has its own blood supply, but heart is the engine to send blood to the rest of the organs. Kidneys specifically, and lower extremities and what have you. So when you're looking at all of that, the plaques will form if there is low HDL. So that's another reason why somebody develops hypertension and hardening of the arteries. And then you have high triglycerides, because high triglycerides will happen whenever your sugars are high. So that keeps the company right there. So now you'll never forget the 5 things that really constitute this syndrome: hypertension, high blood pressure; insulin resistance, that means high fasting sugars; central obesity, remember it's a central obesity where the waist size is big; low HDL; and high triglyceride levels, or high TGs. Now, obviously, you don't need all the 5 to really make a diagnosis, but the fact is that even if you have the 3 of the 5, that's sufficient enough. 1 of the 5 will make you high risk for cardiovascular disease, but 3 of the 5 will definitely put you into the category of diagnosis of metabolic syndrome or syndrome X. Now, according to the American Heart Association, up to 35% of the population, depending upon which age group you're looking at, has one of these 5 conditions. So, we have either already a diagnosed metabolic syndrome in those individuals, or else, because all you need is 3 out of the 5, or else there is a high risk for metabolic syndrome as is. So 35% is a huge number in the population. So we have to be very, very careful and aware as to what we're dealing with in our systems. Women in general are especially there are 2 categories: polycystic ovary syndrome, which makes it a little higher risk, and then you have a family history of either obesity or insulin resistance, which is common, high blood pressure, and these are all familial genetic compositions where you'll see there's a family history as well. Now, quickly, I just want to tell you what on the right side of the panel you'll see. This is my favorite schematic of the heart, where the heart is the circulating pump with 4 chambers. Aorta is coming out of the left ventricle sends the blood across to the rest of the body. Now, what happens is as blood is circulating all around, you'll have either hardening of the arteries, which leads to hypertension. Plaques can form in the coronaries, where one can get angina and other heart attack, cardiovascular risk. So there is a higher risk for cardiovascular disease. Hypertension will also cause hypertrophy of the left ventricle, so the booster chamber looks much bigger, much thicker, and obviously the heart size and the weight increases. Remember, the weight of the heart, specifically the left ventricle, increases, and the chamber sizes may enlarge. So there is a cardiovascular affection, if you will, or the target organ is obviously the heart that affects. And because you have high blood pressure, you have abnormal cholesterol patterns, and you have insulin resistance, you're prone for diabetes and stroke. So stroke is certainly a high risk, as I have shown here, and then vascular disease in the legs, renovascular disease. So it's like the syndrome, even though it encompasses only these 5 conditions, it's the target organs as a physician, as a cardiologist, that I'll be interested in really evaluating these patients for, because that's where one can really either diagnose and quickly treat them or have them prevented. That's the whole idea of doing these vignettes for you. So this way you can keep ahead and stay ahead of the game before the disease onset begins. Diagnosis is very simple. Quickly, I just want to tell you. Well, all you have to do is pick up your measuring tape and have the patient, measure the waist size. Do a fasting blood sugar, triglycerides, and HDL-C as a fasting. So you got now waist size, fasting sugar, triglycerides, and HDL-C, and then have somebody check your blood pressure or do your blood pressure yourself. And you have the diagnosis. Okay? So you need 3 out of these 5 to be abnormal to cause metabolic syndrome or syndrome X. Hope this information was very helpful to you, and again, supplement with the books and journals as we go along, and stay tuned. Thank you for your attention.